Hi, everyone. Thank you so much for taking time to attend today's FEZANA Talk session. My name is Tanya, and I'm the Chief Social Media Officer for FEZANA. FEZANA, for those of you who don't know, represents 27 Zoroastrian associations across Canada and the United States, which is roughly 25,000 Zoroastrians in total. And FEZANA Talks is a new digital initiative that we launched last year to engage the Zoroastrian community in important dialogue and to also showcase our young Zoroastrians. And if you want to stay up to date on future events, I ask that you please kindly follow us on Instagram, Facebook, and Twitter at the FEZANA. So as you all know, we recently passed the 1-year anniversary of the pandemic breakout, an anniversary none of us ever wanted to experience. And I know that you don't need me to tell you how challenging it's been. Our medical institutions have been overwhelmed with patients, and sadly, many people attending our session today and around the world have known people who've gotten sick or tragically lost loved ones due to this terrible virus. And I think we can all agree how grateful we are to our frontline health workers, our doctors, our nurses who have witnessed the worst of this pandemic and yet have shown up each and every day to work and save lives. And yet, while our medical heroes are busy helping their fellow citizens, we see this horrifying rise in false information being spread by non-medical experts, people that I like to call the I Googled it club. And they're causing fear and distrust in the medical field, something that's incredibly harmful and has caused many vulnerable people to be misguided. So as we now begin to hear about the much awaited news of COVID-19 vaccines being rolled out, we'd love to call upon 4 young doctors in our community to discuss what's to come and how we Zoroastrians can ensure to stay safe not only now, but in the future once we congregate together at our places of worship. So my final wish today is that you listen to them, you respect their advice, and ultimately, we all make informed decisions moving forward that takes into account the health and safety of others. And with that, I'd like to now call upon Dr. Hormuz Nicolwala to lead today's session.
Hi, everybody. My name's Hormuz. I'm a neonatal intensive care doctor in New York. And before we start the discussion, I just want to say a big thank you to my dear friend Arzan for organizing this and Tanya for giving us this platform. I think this is going to be a great discussion because the really cool thing about all of us is that we work in different parts of the hospital. Natasha works in the emergency room and, as everyone knows, has been a great global health ambassador and will provide us great perspective on COVID. Dr. Bahrom and Dr. Shahzad actually worked the hospital floors and directly took care of the patients that Natasha admitted from the emergency room. So they will give great perspective on what it was like working the hospital floors. And then I took care of a lot of premature babies and babies born to COVID positive moms. So I'm going to give the perspective on the pediatric population and how it's affected newborn mothers and newborn babies. So with that said, I'll hand the floor to Natasha, and then we'll go to Shahzad and then Bahrom and then me to talk about our perspectives on how COVID affected each of us. And then we'll open the floor to questions, because I'm sure you guys have a lot of questions on the vaccine and things of that nature. So with that said, I'll give the floor to Natasha first.
Hi, everyone. It's great to virtually see all of you. Thank you for joining today. So as Hormuz said, I'm an ER physician. I'm based in Austin, Texas, originally from Orlando, Florida. So hello to the Florida Zoroastrian community. And it's been rough in Austin, in Texas in general, as I'm sure you all have heard us be in the news over and over again as, troublemakers during this pandemic and the epicenter during the summer. So a little bit about me. I was in New York City working previously. I finished my global health fellowship there, and I was working in New York at Cornell and at Mount Sinai. And then I moved down here just a little bit before the pandemic started. Well before, over a year before the pandemic started. So I was just still getting my feet wet in Texas, in the hospital systems here. I work at several hospitals in Austin, everywhere from San Antonio to Houston, but mostly in Austin. And I work in the emergency department, and I'm also on the COVID-19 committee in one of my ERs. So I've been running kind of our response to the virus as soon as the pandemic arrived in the United States and we realized it would be a threat. And In addition to that, I'm a journalist and I've been covering COVID-19 on the news since about mid-March, around the time South by Southwest, which is a very large festival of tech and film and everything, was supposed to be held in Austin, to pretty much stop that and prevent that from coming here, because that's hundreds of thousands of people from around the world that would have shown up right when it was hitting New York City into Austin. And so I've been covering it and I'm still covering it since. So I've kind of seen every angle of this pandemic from the public health perspective. I have my master's in public health, so that's very, hits home for me, and from the ER perspective. But definitely the most palpable, important perspective I have to share with you all is from the ER and from the emergency room and what I've seen. When things first started, as you can imagine, COVID-19 was really isolated to New York City in America, and it was just sprinkling in other cities in the country, but it was really held in high volumes in New York City. And I had just left there. I had colleagues in 5 of the hospitals in New York City warning me down here that it's coming, it's going to come to your city, and this is what it's going to look like. And I remember not seeing it anywhere in any of my ERs here, but fearing it. I mean, as you all feared the vaccine, we were going into lockdown, but I really hadn't seen sick COVID patients yet. We couldn't even test for patients. So patients who came in for sniffles and a cough and a runny nose, we didn't even have the capacity to test them for COVID-19. We would just say, you might have it, we think you might have it, go home and isolate, and be on lockdown like everyone else, but isolate in your room. And if you get sick, come back. But no one really got that sick at that time. And that was before COVID had hit, really, for Texas. And, we have this consortium of about 20,000 ER doctors across America that really became a big deal during the pandemic, because we were communicating aggressively on what to expect. As you can imagine, as many of you might have experienced, a lot of clinics closed down for the right reasons. We didn't have enough PPE or masks or even gowns and gloves at that time to sustain us. So dentists, primary doctors, surgeons, orthopedists were all forced to really shut down their clinics for quite a bit of time, to halt elective surgeries. And a lot of that burden then fell on us in the ER. We can't ever close our doors. And we won't ever close our doors. And, we were functioning through all of this fear as best as we could. And that was probably the most terrifying part of my job. As an ER physician, I see everything. I see sick babies, I see sick grandparents, I see car accidents, strokes, traumas, heart attacks, you name it. Everything that will come into the hospital has to come through me or through one of my colleagues. And I've seen the scariest things I ever thought I would have to see. But that level of fear was very different when, in the first time in my career, and arguably for any of our careers, we'd seen something that might hurt us. Never before have we seen something where, by treating the patient, we might contract what they have and we might die. And, just a month and a half ago, I lost one of my colleagues to COVID-19, who may have survived if he had gotten the vaccine, but hadn't gotten it soon enough and contracted COVID. And one of the docs in our group passed away. It's been a really difficult ride for us. And, I'm sure each of us will have our own experience to share with you, but it's difficult. This virus is very ageist. Most of my patients who have come in and not left the hospital and who've passed away from this virus and who've suffered tremendously, unfortunately, are the elderly. And we haven't done enough in our community, in our society, really, to help and protect the elderly. There's a lot of fear against the virus, but when it comes to our younger populations, they're not really as afraid. Arguably, that's understandable, because most young people do okay with this virus. But, the sense of wanting to protect our elderly, I think, is something that we've seen just not be as present as if this was a virus that affected our children. And that's really something that means something very deeply to me. Most of my patients are elderly and I care very deeply for them. And so protecting them and all of your loved ones, everyone who's over the age of 65, if they haven't gotten a vaccine yet, please get them vaccinated. They can get the vaccine in every state right now. And hopefully all of the states will at some point very, very soon open up the vaccine to everyone, any age, over 16, I believe. Some might be 18 or over. So hopefully it will be available to anyone. So please go get it. It's been a very difficult journey. And another thing I think is really important to know is that even though, we commonly tell people the truth, which is that this virus affects the elderly far more than it does younger patients and children, it doesn't mean everyone who gets this virus will survive. Anyone at any age group can die from this virus. Anyone at any age group can fall critically sick from this virus. But the good thing is the likelihood of that is pretty low when you're younger. It's very low when you're younger. But we want to protect us, and this is our chance to really come back in 2021 and make up for all we've lost in 2020 and try to get back to normalcy as a community and get our Zoroastrian community back to our really great get-togethers and, go back to our agyaris and our temples and really have a good time as a community. We're small and we're tiny, but we're mighty. So we need to protect ourselves. So really, please, my one plea to all of you is do your best to protect all of your fellow Zoroastrians and encourage them to get vaccinated and stay safe. We're not through this yet. We've got a long way to go.
All right, that was awesome, Natasha. That was really, really good. We'll go next to Shahzad and then Bahrom, and then to me, and then we'll open the floor to questions. Thanks.
Thank you, guys. Shahzad here. I'm a third-year resident in Roger Williams Medical Center in Rhode Island, originally from Toronto, Ontario. So COVID, when it started, actually, I remember I was on admitting nights, which is a service that we do in our second year. And we admit the patients into the hospital after the emergency room physician has seen them. And this was last February. And I remember reading reports and hearing, stories of things happening in China and Wuhan, and, all the crazy videos that were being passed around on WhatsApp. And at the time, it was scary. It was very scary because I was the second line person. And actually, we'd have to wear these special filter sort of masks that used a HEPA filter. And we had to also wear like a special mask underneath that called an N95, which is a very tightly fitted mask because of how unknown this virus was and how dangerous it could be. But I had a lot of friends who were also infected with COVID in the program. I had actually one of the physicians I worked with was admitted into the ICU, and he's okay now, but he was quite sick. And the program is set up in a such way, so we have multiple rotations, and primarily it's the floors, ICU, and step-down unit, which is Maxi. And when the virus started, when the pandemic started, the floors were kind of empty and quiet for a while, but the step-down unit and the critical care units were almost at double the capacity, sometimes triple the capacity. And it was something that none of us ever foresaw, working with so many critically ill patients. It was very difficult. Many of them passed away. Many of them were older, but there were some young ones who also passed away. And it was also very, as Natasha said, it was very scary because we saw a lot of reports coming in of physicians passing away, nurses dying, and even some residents died from COVID. So it was scary, but we did the best we could, and we tried our best with these patients. And it was also very emotionally tough for us because we had to sometimes call families through, FaceTime, and they could not come and say goodbye to their loved ones who were going to pass away. And that was very difficult because many times they would plead with us or plead with the hospital to come and see them. We also in our program have an outpatient rotation where we work with a clinic as primary care physicians. And that was also sort of shut down because of concerns of passing on the virus or just lack of equipment. That was also difficult because many of them would call us. We do telemedicine visits, and they were asking us questions, and the patients were very scared too. We had initiatives with our hospital to do screening with other sort of lower socioeconomic populations, and that was also discontinued. And overall, it was a very trying time, but we persevered and we made through it. And we all got vaccinated. And again, as Natasha also said, I would like to, reaffirm the vaccination, that everyone should get vaccinated unless you have some sort of severe anaphylactic reaction in the past. And if you're not sure where to get vaccinated, contact your local state or health officials, and they'll direct you to where you need to get vaccinated. But I do think vaccines are very important and necessary. That's it.
All right, thanks, Shahzad. I think it's really important, like it's a good succession because Natasha is like the first line of defense against COVID being in the ER. The second line of defense is Shahzad and Bahrom because the patient goes from the ER up to the floor. So I think the perspective you guys give is really good. So Bahrom, tell us about what you went through and stuff.
All right, thanks, Hormuz. So I'm Bahrom Firozgary. I'm a second-year resident doing family medicine, which is essentially primary care where I sample different aspects of all types of medicine, and then interested in sports medicine. But right now I've actually, because I'm in residency, I'm not sure if Shahzad mentioned specifically, we're sort of moved around quite easily in our time. So during March when the COVID started, I was actually working the night floats. I would go down to the ER, I would receive a patient from someone like Natasha, and then would sort of break down what was going on. And at that time, there was a lot of unknown. And so I think fear was a feeling that was common in the beginning. It started off from fear, and then I think, frustration was another one because we didn't have answers. And when I moved from that shift, I went on to my ICU rotation. I truly saw that in the ICU, which is the highest level of care in the hospital, it was a war zone almost. It was something that you see in a movie, like this dystopia, because you go outside, you leave the hospital. Doctors are humans too. So when we go home, we have families, we have social lives, we have people we care about. And when you go see that, everyone doesn't really know what's going on at home, but it's just alive in the flesh in the hospital. It's sort of hard to communicate the feelings and the reality and the seriousness of what's going on. So I think in the beginning, a lot of the feelings that I had were, fear, frustration, and then it sort of shifted to maybe in my OB rotation where I work with pregnant women and I deliver their babies. You see kids get taken from a mom because they were COVID positive and just leave their mom's arm. So even if it's a first-time mother, they get a hold of mom for an hour, and then if that, and then they're gone to the NICU where Hormuz works. And that alone is traumatic, So then it ended up being, you talk about fear, frustration, you just feel sorrow, sad. For me, I then went on to the medical floor where you deal with patients with common illnesses. And we talk about how dangerous COVID is in itself. It can cause death, especially in the elderly and the, maybe the obese, diabetic. There are specific demographics that are affected more heavily, as Natasha touched upon, Shahzad as well. But it also affects young people, maybe not as drastically, but with blood clots, with complications that you don't realize could be caused by a little virus, that some media, some people may undermine. Some people think it's a hoax, and for whatever, we'll stay away from those. For whatever you might be hearing from Dr. Google, from all these news stations, I think what we've been sort of hitting on is that come to us, come to the experts. And I think if you don't have a doctor that you can talk to or reach out to, the CDC government website, we have a lot more known now. So even if there were some things that might have been said earlier and they're changing now, it's because in our best efforts, we're trying to provide the most accurate, up-to-date information. And as of right now, the most up-to-date, accurate information is we should be getting vaccine in the US. We should be getting our vaccines. Moderna, Pfizer, those are the most efficacious right now. I have no affiliation. I'm not name dropping for any reason. I just I received the Pfizer personally, and I had my family, everyone I recommended, because I would ask you all to just think, how would you feel if you lost a loved one from COVID? I personally have loved ones, colleagues, patients of many ages. So with regard to preventing death, that's what those vaccines do. And it can minimize symptoms. So that's, I think, alone something great, especially if you qualify. On Monday onward, Texas, any age adult can. I just also lastly wanted to leave with another experience I had. So again, I've discussed, I've worked with infants, 1 hour old. I've worked with people in the middle ground from, teens to adults, but then even, at the end of life, I've worked with hospice teams, palliative medicine, which is the focus on end of life care for people who don't really have a great prognosis. And the sad reality is COVID is essentially that. Not to incite fear, but just to incite maybe motivation to be more proactive and cautious with our habits and get vaccinated, because it's preventable. And in some aspects it's not, but I'm just saying we can do our part to minimize the effects of it. And you can help us out, you can help yourselves out, you can help your loved ones out. And like, I love what Natasha said, we're small but mighty. The reason we're so resilient, the reason we're here is because I think our religion in a whole has focused on things that make sense, the science of stuff. Being a Zarathushti, doing the right thing because it's right. I think this is one of those situations where we should step up and put whatever media, politics are being discussed, and just let's stick to the facts and stick to what is right. So Bahumano, let's achieve that. And we're here for you. I know we're eager to answer questions. No, none is a dumb one. I see the chat is blowing up, so I will stop here now. I wanted to say one more thing, how it's affected our lives emotionally, physically, socially, economically, even religiously, but what's cool is in the Houston community, I'm a Mobed, so when I pray, we have our Zoom setups. So even amongst all the frustrations, fear, sadness that I talked about, there's also some hope and some excitement for how we came together and how we're coming together, and we're still fighting through it. We're not just giving up. So I implore y'all to not give up, to keep fighting this good fight, and hopefully we can have a Congress in New York in a year and get back to Jeshans in person, so there's things to look forward to. And thank you all for tuning in and for hosting. Hormuz, you're up.
Thanks, Bahrom. That was awesome. My name is Hormuz. I work in the Neonatal Intensive Care Unit in Long Island, New York, which is basically the ICU for newborn babies. And whenever we talk about like our healthcare system, we're always talking about the burden on the older population, and then the burden on taking care of the pediatric population, since they are the future. And whenever we talk about babies, whenever we talk about kids, there are two patients. The patient is the baby, and the patient is also the parent, specifically the mother. So during this time with COVID, you would think that there would not be a lot of babies being born because there's COVID in the environment, but what we actually saw, there was a large surge of babies being born, and a lot of these babies were being born to COVID positive mothers. And of these babies, a lot of them were born premature. Usually a baby should be born at 37 weeks to 42 weeks. We had babies born 26, 27 weeks to COVID positive moms, and these babies were much more sicker than our traditional premature babies. And so one of the things we always do in our hospital and other hospitals is you have to go counsel these mothers. So whenever we would go counsel these soon-to-be new moms, we would tell them that since you're COVID positive, you're not going to be able to see your newborn baby. You're not going to be able to touch your baby. In many of the deliveries I attended and we attended, a pregnant mom would give birth to her baby, and then the baby would be taken to another room to get the normal newborn care. So a lot of these moms didn't even see their baby for 14 to 21 days following the birth. And that was very trying on these parents. And the other thing that made it worse is fathers were put in very difficult situations. They had to decide, do I want to stay with my COVID positive mother and support her? or do I want to go be with my baby? And if they chose to be with their baby, they would not be allowed to be with their wife. If they chose to be with their wife, they would not be allowed to visit with the baby. And you're looking at sometimes 21 days, a mother has no contact with her newborn child. Her newborn baby can be with her newborn child. We had a lot of babies. Some of these premature babies that were born to COVID positive moms were very, very sick, and some of them died. And I remember 2 cases very vividly. The mother was not even able to be present at the death of her child. We had to do it over FaceTime, which losing a child, as you know, is very tough. Losing anybody is very tough. But when you don't have, when a mother can't have that ability to be with their newborn child, it's very taxing on everyone. And I just want to bring up what Natasha and everybody else were saying about, like, we used to have to go to work every single day. Even if you didn't have clinical obligations for that day, you were required to be at the hospital. You were required to be a helping hand. And we talk about masks and we talk about having to wear these N95 masks. Some of us wore N95 masks, the same mask for a month. And you're not supposed to wear an N95 more than twice. Some of us wore the same mask for months. And in the heat of the moment, I don't know if you think of your own safety every day, because it's more like, oh, you need to be at work, so you need to come. But looking back on it, like, I never took the time to like think about these things. I just took it for granted. I have to be at work, I have to help, which is basically how we're trained in residency and in our career. So it was just a very interesting time to be with these premature babies and newborn moms who couldn't have contact with their children. Now, hopefully with the advent of vaccines and more people getting vaccinated, those restrictions will be lifted, because a lot of these hospitals aren't even allowing visitors. And I think Shahzad, Natasha, and Bahrom can attest, like, a lot of these COVID patients that died in the hospital, a lot of them didn't have family by their side because hospitals didn't allow visitors to come in. And most of them, a lot of the hospitals still don't allow visitors to come in. So a lot of these COVID patients that passed away didn't have any family by their bedside, which is very sad. You live your whole life, and then at the end of your life, you have no one there to be next to you. So it was just trying on both as a provider and most of all as a patient as well. And you don't take the time to think about it when you're in the heat of the moment, but it was just a very difficult time. So with that said, I give the floor back to Natasha, and then we can field questions about, looks like everyone wants to know about the vaccine. We had some good nutrition questions, which I've actually been speaking to my father about since he's a physician. He's been telling me about stuff with nutrition, so I'm interested to see what everyone says about that. But looks like every question is on a vaccine, so I'll give the floor to Tanya.
Natasha, are you saying anything else? Sorry, I thought you said first Natasha might be wrapping this up.
Sure, I can close up real quick. So thank you all for your comments, and your questions are fantastic. So we look forward to answering them. And, you know, a lot of you are thanking us and thanking the health workers, which we really appreciate. And I just want to say, you know, we signed up for this job. You know, we signed up to be physicians and care for our patients. And so while we appreciate the thanks, you know, this is also, you know, what we signed up for, but we want to extend a thank you to all of you. You all didn't sign up to have to quarantine at home and be on lockdown and not travel, not see your loved ones, you know, not go to the Agyari, go pray, go be with the people that you love. And you all have made tremendous sacrifices for all of us, for our healthcare workers. You know, we would be in a far worse situation if all of you didn't do everything that you did. And we are very, very eternally grateful for all you did and all you're continuing to do to protect each other and to protect all of us. And just remember, every sacrifice you've made, we know that there's a toll that's been had. You know, some of you have had grandchildren born and haven't seen them in over a year. Some of you have had loved ones pass away and never got to say goodbye. there's been tremendous sacrifice globally in every country, every community, every field and profession. No one has been spared except maybe Jeff Bezos and Amazon. Everyone has made tremendous sacrifices. And we all, as I'm sure all of us agree with this, thank you for everything you've done and you continue to do. And I promise you, there is an end to this fight and we just have to hold strong. The finish line is visible. We're at the end of this marathon, and at the end of a marathon, we don't slow down, we speed up and give it everything we've got. And we're there now. So thank you for everything and keep fighting.
Thank you so much. Natasha, Shahzad, Bahrom, Hormuz, thank you so much for your time today and for sharing your knowledge and expertise with us. I think one thing people have to remember is doctors don't have a 9-to-5 Monday to Friday job like some of us might do. So I know Bahrom and Natasha, you still have to kind of go and do your shifts today. So thank you so much for being here and for all of you for giving your time. Also, I think on behalf of all of us, our sincere condolences for you who have lost your colleagues, loved ones during this time, and for being there and seeing some things that we could never, comprehend that you have done and still continue to work. So thank you. And condolences to anyone else attending today who has also lost loved ones. I don't know what else to say. I know it's a very difficult time for everyone. But the best thing I think moving forward is just making sure we take the right step forward for our community and for others, and making sure we're doing things that are safe for others and not just for ourselves. There's a lot of questions. Thank you, everyone. I'm going to try my best to get through all of them. And I just want to start off. One question is, now knowing that pretty soon, I imagine, our places of worship are going to open up, Zoroastrians are going to gather again. I'm just wondering if you have maybe any advice you have for Zoroastrians in the community to ensure that we're being safe, we're keeping others in mind. What can we do to make sure we do this correctly? Especially because I know we're going to have congresses again, and we're going to have people from all around the world coming. Any kind of advice you have?
Well, off the bat, I think a common theme in this comment section is get vaccinated. We're blessed as a country to have it available so much, even if it's slow, whatever critiques we hear, when it's your time, please get it. That's the one time I say go to Dr. Google. You can literally Google your city name, where can I get COVID vaccines? Some of us have specific links as well, but that is key, especially if you're over 65, you've qualified. 18 and older with comorbidities, you're already there. And now we're getting it to everybody. So that's step number one. I will say that at least. And to answer, I guess, some of these questions briefly, I don't want to skim it. I don't want to just summarize it quickly, and please chime in, anyone, at any point. In the United States, we have Pfizer, Moderna, and the Johnson & Johnson. Those are the big three. And, they talk about different numbers and stats, and the key point is that they work. They prevent death. That is the big thing with vaccines. You want to prevent death. And that's what the goal is right now. So with these, in terms of how well they work, the 2-dose series typically have better rates of the efficacy of those are better, meaning they can provide immunity better. And Natasha, I know you're on a workforce or a task force at your work, so you can explain further maybe. But those 2-dose series are the ones that have the higher number. But at the same time, if we are all getting vaccinated in a promptly fashion, then we don't have to worry as much as, how great is this or not. In terms of booster shots too, we can get into that. A lot of answers are still unknown, but the big step to us getting back, just in life in general, as close to a normal, is to get that vaccine.
I think another thing to add is, trust your authorities, your health authorities, your state authorities, trust the CDC, practice social distancing, wear masks, and as Bahrom said, get vaccinated. I think it's very important that we don't question the people that are looking out for us and the studies that are coming out and the authorities that are involved in these studies. I think it's really important that we continue to follow the guidelines that are set out to us by our physicians and our state authorities.
Yeah, I agree with everything both Shahzad and Bahrom said. I think when it comes to gathering as a community in prayer and in homes and in get-togethers and for those of you lucky enough to live in a city or state with an agyari or a temple, gathering in our places of worship, we're not ready for that yet. In any state, we're not ready for getting together in massive groups in any sense. We're going to get there though. And so I want to be really optimistic and really encouraging of everyone is once we get to a level of herd immunity where it's safe, we will get there. But right now, just, be really mindful that when you're with other people, be mindful that everyone there is vaccinated already. You're not with high risk persons, and, be mindful of who those people live with. We still strongly encourage when you're with other people to social distance, to wear a mask, even if you're vaccinated right now, unless every single person that you're with is vaccinated. And just be really, really careful. If, I'm vaccinated, my brother's vaccinated, my parents are vaccinated, I can visit my parents and my brother, and, we can, have a good time together. And that's safe because the likelihood of us contracting COVID is negligible, and the likelihood of us falling seriously ill from it is essentially zero, or very close to that. So that's not the same situation as a family or a birthday party or a bridal shower, whatever it may be, where there are plenty of people with unknown vaccine status. And one thing to really keep in mind is even if all the elderly people are vaccinated, or everyone over the age of 50 is vaccinated, and there's a 20-year-old or a 5-year-old who comes to that event who's not vaccinated, they may have COVID, they may get COVID, and even though they may be just fine from it, they may not. They may still fall seriously ill and have long-term symptoms called long hauler syndrome, or long COVID syndrome. They may still get that. And worse of that is they may take that virus to someone else who may then die from COVID-19. So this right now, we're in the stage of this virus where it's not so much about how do I protect myself? How do I protect myself? But we are at the stage of the virus where it's how do we protect our community? So for this particular talk, it's how do we protect our Zoroastrian community, our loved ones, our family members. And this is a sense of community that we have to have and really push through that. And that's really the mindset that we want to be the take home point from today, is that, it's not so much at this stage about what are my risks of attending this event, but what is the overall risk of this event to this group of people? And is my attending this event going to increase that risk? So really try to keep that kind of algorithm in your mind when you think of going to things, going to dinner. Is it indoors or is it outdoors? Is it social distancing? Now we're very lucky that it's warming up everywhere, maybe except Toronto. I'm not sure how the weather is in Canada, but I can only assume it's colder. So once things warm up for everyone, hang out outside, go to the park, be outdoors, social distance, wear your mask. You can really get so much more happiness and joy, I promise you. So keep those things in mind when you think about a lot of these questions.
And just to piggyback off what Natasha and everybody was saying, the purpose of vaccines is not so much to cure the individual, is to do the greater good and protect the community. So all this new vaccine, like 20 years ago, we had new vaccines. We had the hepatitis B vaccine, we had polio vaccine. We've had these vaccines part of our community infrastructure for years. And there's a reason why you don't see polio anymore. You rarely see hepatitis B anymore. There's a reason why you don't see these things. It's because the community has developed immunity through vaccines with them. And it's normal to question a new vaccine because the last phase of a vaccine trial is its effects on humans. And you don't know what those effects are properly till 3-4 years down the line. But with that being said, the same questions that you guys have about the COVID vaccine were there when the flu vaccine was initiated and were there when we had hepatitis B vaccines, polio vaccines. So all your concerns are valid, and it's a good idea to have these thoughts in regards to vaccines. But the whole point of them is to protect the community. And by protecting the community, you protect everyone of all ages. You protect the little children that are at the gatherings. You protect the other older people who are at the gathering. So the vaccine is not a cure for COVID. The vaccine is a prevention method to prevent the spread of COVID and limit the effects of it. And we've had vaccines for years. Some people don't like getting the flu vaccine, that's okay. But it's really important to have the right knowledge and go to like the CDC and ask your doctors. Don't go to Mr. Google to give you the answers. It's really important to be informed about what you're putting in your body and the reasons why we do it.
And I have further segues. So I think we're being productive. I'm going to try and answer some questions too. So a few questions to answer. What type of mask should you wear? As Natasha and Hormuz said, we should be wearing masks. We're not at a point to where we should go back to whatever we think we're going back to. The CDC has specific recommendations, and as Shahzad said, who to trust. I know all of the aunties and uncles are on WhatsApp groups, and you're getting these scary paragraph long from this doctor from somewhere. I would say try to stay away from those. If it sounds anything absolutely scary or fearful, maybe take a step back and try and do type in CDC recommendation for whatever, or again, talk to a doctor in the flesh. We will have maybe our contact information available. CDC recommends that we keep our PPE, the N95s for the healthcare workers. Medical masks otherwise should be fine. In terms of wearing a mask amongst, masks, I usually have so many everywhere, plastic waste, but essentially a medical grade mask is ideal, but anything that's a cloth covering, some people wear the visors that isn't preventing aerosolization. I wouldn't recommend those. Something that's a mouth covering and nose, because that's where on top of your skin, the virus can remain. So aside from a mask, there's also, as Natasha said, social distancing. But if in a room or a enclosed encounter, if you're all vaccinated, the CDC does recommend, yes, you can be without masks, but you have to be cognizant of who are they going to then go see, or because you can still be sort of a carrier for the virus and go get someone else potentially exposed. So again, for all specific questions on masks, what type, the CDC is great for that. We have some Zoros that actually work for them, and they do a great job there. A second question is, and that answers some of the questions on hugging grandchildren, people with comorbidities. Again, the principle is the same, is get vaccinated. Even if you have to, until you know the majority of people are, until you're told by authorities that it's safe. And right now we are not saying that. The CDC does not recommend that. Keep social distancing, mask policies at place. The second point I wanted to make was sort of what Hormuz was talking about with getting vaccinated, know what you're putting in your body. So Fauci, again, that became like a political word, but just in terms of the facts of vaccines, it does take years to find out the long-term effects of some vaccines. But in terms of the catastrophic side effects or the lethality or the things that would make a vaccine just absolutely dangerous are usually in like a 30-day window, or sorry, in a 90-day window, in a 3-month window. And in all these studies, although they've been rushed for whatever reasons, they've exceeded that window. So we are comfortable recommending these things because we know that the scary side effects that are typically seen weren't seen in that traditional trajectory. So in terms of getting the vaccine or not, the hesitancies of it's going to give me 5G reception or Bill Gates is going to track us. It's just, I'm being facetious. Those are jokes you might hear on some media, but the reality is that those don't exist, and we don't want you to keep thinking that. So let's cut that right now. And I was trying to answer more questions, but anyway, as they come along, I'm reading.
I see this question from Oshrid about whether this COVID vaccine was basically rushed into its making. So if you look at the studies, it takes about 5 years for a vaccine to be developed. But the thing that makes the COVID vaccines a little different is they're based on mRNA. And over the last 10 years, mRNA was being studied and highly and was being developed by researchers. All they had to do to accelerate the making of this vaccine was sequence the COVID virus. So once they were able to sequence the COVID virus, the research behind the mRNA vaccine was already done. And if you look at the CDC and you look at the WHO, whenever there is a global pandemic or situations like these, they do accelerate the vaccine development. So it's not so much that the vaccine was rushed. We already had the research, we already had the technology in place that we were looking at mRNA vaccines as the new type of vaccines going into the future. We just needed to sequence the COVID virus so we know what part of the virus to attack with the vaccine. So it's not so much that corners were cut in the making of the vaccine. It's just whenever you have a global pandemic, things get accelerated.
Yeah, I can touch base on that a little bit too, Hormuz. I completely agree with that. So a big reason that the vaccines were able to be made so quickly, it's actually been an issue with the government trying to rename the entire initiative. They named it Warp Speed, which was very unfortunate because we didn't cut any corners. We didn't do anything faster than we would have done otherwise. What happened was we've never had a time where we've had a virus affect so many people globally at the same time and able to run studies so quickly. For example, with pregnant women, we've already had 100,000 pregnant women get the vaccine and do just fine in every state of pregnancy, including fertility patients. You know, we could have never done that previously in history. We also have the technology to analyze different parts of this vaccine and produce different parts of this vaccine in tandem. So we have things running simultaneously to get across the finish line, whereas 10, 20 years ago when other vaccines were developed, our technology was much slower. Studies were done slower. Production lines were much slower. Even in India, you know, I'm sure all of you have heard of the Serum Institute. You know, Cyrus and Adar Poonawalla, who are fellow Parsis, have really been doing a tremendous job of getting the AstraZeneca vaccine and really producing these vaccines in mass quantities for developing countries. And, you know, even their process has improved. So while things have been done faster, it's not because corners were cut. I assure you things were done diligently and arguably more stringently than any other time in history. Never before have we had this kind of scrutiny for a vaccine ever. And never before have we been this transparent with the public about studies and, you know, vaccine hesitancy and vaccine efficacy and using all these big words in the media. And as a journalist, you know, going on air, never before have they covered things to this degree. And we're doing that intentionally to give reassurance to everyone that we're doing our due diligence and we are being very cautious with this vaccine. And I can assure you that the level of strength of these vaccines is way stronger than we ever anticipated. I mean, we were hoping for over 50% efficacy, and the levels we've gotten out of every single vaccine that has come out has really blown that out of the water, which is really phenomenal. Remember, we've had over 500 million people get vaccinated now. You know, we would know by now if there was something terrible to be concerned about, and there just isn't. Let me just run through, I know there are a lot of questions, so I can run through a few of them and then pass on the mic, but some important ones. So someone asked about a Johnson & Johnson vaccine versus the mRNA vaccines, and if you strongly dislike needles, would we recommend one or the other? That's a really big question that's come up is, should we take the Johnson & Johnson vaccine or should we take the Moderna or the Pfizer vaccine? And I will say they're very different technologies. You know, Pfizer and mRNA are essentially the same for all intents and purposes. They're both mRNA vaccines, similar efficacy, you know, similar way of functioning in the human body. And the Johnson & Johnson vaccine is an adenovirus vector vaccine, which, you know, you don't need to worry about the details. The important thing to know is they both are 100% effective against death. That is the most important thing that we care about. One of them, the Johnson & Johnson vaccine, is a single shot vaccine. So the only people that I really recommend to pick one over the other is people who are extremely needle phobic, which is more people than you'd think, but people who are terrified of needles. If you think getting a shot is just absolutely terrifying to you, as I feel about spiders, and I totally relate to that fear, then, you know, go once, make it easy on yourself. Don't make that burden to vaccinate yourself or your loved ones so high. Or if someone is physically handicapped, you know, in a location where getting them to get a vaccine is an extreme burden on you, go for the 1-dose vaccine and try your best to get that, just to make your life easier. Because if you get that first dose, you really got to get that second dose. Those are the only 2 populations, and everyone else, I really just encourage, get whichever one is available to you first, because time is of the essence, and overall your immunity is going to be the same as we go on. Johnson & Johnson vaccine gets stronger as you go. So, you know, they're both really great options for you. The other question I wanted to touch on was, someone asked about, you know, risk factors for COVID-19. And, you know, what we know about COVID is that as you get older, your risk is higher, period. This virus affects elderly at astronomically higher rates than the younger. It doesn't mean if you're 90 and you get COVID, you're not going to survive. That's not what this means. I work in one hospital where the majority of my patients are over the age of 75, and I love them all. And a lot of them have gotten COVID and done okay. It doesn't mean you're going to die if you're elderly and you get COVID. But what it does mean is your risk is much higher of everything, every complication from COVID, suffering from COVID, being hospitalized from COVID. And what it also doesn't mean is that if you're young and you have no medical problems, that you have no risk for anything bad happening. I've seen young patients die of COVID. I've seen young patients put in the ICU. I've intubated 20-year-olds from COVID who are still suffering months later. This is not a virus that just, you know, is, if you're 20, you're going to be fine, or if you're 30, you're going to be fine, or if you're 15 or 5, you're going to be fine. The truth is, we just don't know. There are so many factors in place, everything from your genetics, your blood type. I mean, there's so many things. Everyone's immune response is very different. So keep that in mind. And the other thing is, hi to my nephews who are watching. Hi, Zubin and Xavier. There are a couple of other questions that
I can pitch in too. There was one that was asked about a lot with fertility, breastfeeding mothers, and there are some papers recently released that it is safe in breastfeeding mothers and nursing mothers. They sometimes recommend, maybe not in the first trimester of pregnancy, wait till after week, till the second trimester onward. So that's specific to the person of whom you were asking. And to Natalie, apologies for any confusion. I'm not at all downplaying any fears of this vaccine at all. They're all 100% legitimate, and I appreciate you speaking up. I think an additional point was it was the fertility and reproductive age, nursing mothers. I had a patient, so, and again, not to incite fear like Natasha, Dr. Kathuria said, it's more of to prevent these things from becoming scary. So I had, for example, a mother who was 19, pregnant, 3rd trimester, about to give birth to her baby. She had a baby shower. They didn't social distance, they didn't have masks, and 6 people of the 15 there got COVID. 3 of those 6 died. This patient has, for 3 months now, been on a ventilator. Baby was delivered. They did a C-section, took the baby out, and it's living its own life without the mother, without the grandfather, without the grandmother. They were in the ICU next to each other. And so I think, just to put it into perspective, is this vaccine is safe, period. It can prevent death. It can prevent then also all these things we're talking about. And so all these scary stories. So in terms of the long-term effects too, yes, even if you're young and you don't get the scary death or like the scary ICU stay, there are links to your blood being more thick, so that can cause clots in your lungs and your legs. And so again, the big key is trying to get this done as quickly as possible. Get your vaccine as quickly as possible. Dr. Mehr, were you going to say something?
Yeah, I was just going to add. So there was a question on booster shots. This, a virus, like all living organisms, evolves. It's kind of how everything changes, and over time, generally viruses, especially these sort of coronaviruses, become less lethal and they become more transmissible. So do I foresee booster shots happening in the future? I would say so, yes. The R naught, which is the amount of people one person can infect with the virus, has actually dropped down from 6 to 1.4 to 4. But it doesn't mean that the virus is going to get more lethal over time. It just means that it might just be getting more transmissible. Will we have vaccine escape, in the sense that will we have vaccines that don't work anymore? That's hard for me to say. There is some data coming out which is showing that the effectivity of the vaccine over the long term might decrease, and you might need booster shots. So yes, I do think we will have booster shots in the future. There was a question on herd immunity. I believe it's anywhere between 50 to 70%. This is the numbers they're looking at for vaccination rates for us before we have herd immunity. And another thing about, and I want to sort of reinforce that everyone else has mentioned, Hormuz, Natasha, and Bahrom, is the fact that, we, as physicians, we look at everything in the terms of relative risk. Is the risk of doing something greater than the risk of not doing something? And as everyone else has mentioned, the risk of you getting the vaccine, the long-term effects, is far, far less than the risk of you getting COVID and having poor outcomes from the infection. So again, as ad nauseum, I know it sounds like it, but it seems like I think all of us are, again, reinforcing the idea that we should get vaccinated and try to get vaccinated as soon as possible, and as per what your state health authorities guide you to do. But I do think that it is very, very, it's a very, very scary virus. And I mean, there's stories. There was a person who was a young guy, actually in his 40s, who was intubated and in the ICU, and for 4 weeks we were trying to keep him alive, and he didn't make it. And actually, his wife also contracted COVID, and she also passed away. So again, the risks of you not getting the vaccine are far greater than the risks of any sort of potential side effects that can come about from getting the vaccine. And that's it.
I can answer a couple more questions that came up. One of them was about nursing mothers and whether or not nursing mothers can get the vaccine. Yes, they can. We actually think that, well, now we know that pregnant women who get the vaccine, at least during a certain time in their pregnancy, their babies, are actually born with antibodies to COVID. So that vaccine is also protecting baby to some degree. And in lactating, we think it's the same thing. If you're, one of the best parts about breastfeeding is why in the medical community, we really encourage mothers to breastfeed as much as and as long as they possibly can, is because you're transmitting a lot of your own protection to the baby and building baby's immune response. So once mom has a vaccine and builds those antibodies, she's going to pass those antibodies on theoretically to the baby. So it is safe to get it. I would say there's some recommendations that, if you get the vaccine, don't breastfeed your baby within a certain amount of time so that, the mRNA is not transmitting to the baby, but it's not, we don't have any evidence that it would ever do that. Also, remember the mRNA technology for the Pfizer and the Moderna vaccine, that mRNA is only alive in your body for a few hours and then it degrades. It's not something that's even there more than 4 or 5 hours in your body. So it's not going to go very far. It's just sending a message. It's just like sending a letter to someone, them reading the letter, and then that letter gets disintegrated. That's exactly what's happening. And then your body has the information to start creating antibodies, and that's how it's working. So it is safe to get the vaccine when you're breastfeeding. Obviously talk to your doctors about if there's any time constraints about how long you should hold off and maybe pump and store some milk before, and then give baby pre-pumped milk during, 24 hours after the vaccine, or 5 to 6 hours after the vaccine at least, and then you should be okay. Another question was on variants and how many times can the virus mutate. I will tell you there are thousands of variants already for COVID-19 worldwide, thousands of them. We don't worry about most of them because most of them are very trivial variants that don't really do much in terms of infectivity or how aggressive it's going to be. As you know, we are concerned about a few of them. The variant that's very commonly known as the UK variant, the Brazil variant, South Africa variant. We've got these mutations that are concerning, that are increasing the infectivity of this virus and are increasing the amount of people that will fall sick and die from this virus. So the answer to that question is it can mutate constantly. It can mutate multiple times in a person, which is why even though young people are much less likely to have any adverse consequence to the virus, we still need to obtain herd immunity globally. And that's why global vaccine equity is very important, and not just vaccinating Americans and North Americans, but vaccinating Indians and Africans and Europeans, because as long as this virus is circulating, it's going to keep mutating. And the more it mutates, the more likely it is that a dangerous mutation can come out of it, like very dangerous, like switching strains. We need booster shots. We need to change the vaccine. Right now, we haven't gotten to that point. Right now, we aren't at a point where we're, oh my gosh, we have to switch up the vaccines and start all over. And we really don't want to get to that point. And the way to prevent that from happening is to just get to herd immunity as quickly as we can, especially in North America, because travel is much easier within continents, but on a global level. So do your best to encourage people to get vaccinated, and that will help with that.
And just to piggyback off that, like coronavirus was here last year, it was here 5 years ago. That it's just mutated over the years to now cause the harm that it's causing. Children have been getting cough and colds all the time, and you swab their nose for viruses and they will come up positive for coronavirus. It's just a different strain from what is prevalent right now. And now, like Natasha is saying, the virus has just mutated to a point that it's affecting more people. The flu mutates every single year. That's why one year the flu vaccine worked great, and then the next year the vaccine didn't work great. It's because all these viruses are mutating. It's just most of the time when they mutate, they're not getting more virulent. This COVID strain and these variants that are arising from the mutation have the potential to be more harmful. But viruses have always mutated. These viruses have always been in our environment. Probably when you were a child, you got a COVID virus causing you to have a cold. You just didn't think much about it because it's not causing a global pandemic like it is now. But last year, I took care of like 20 kids who were positive for a type of strain of coronavirus. So it's been there. It's just the vaccine is there to try and help deal with the mutated forms. And like, that's what we're trying to aim at with the vaccine. It's not so much, this is a new virus, we've never seen it before. We've always seen coronavirus. We've always seen the flu virus. It's just changes every single year.
Thanks, Hormuz. Yeah, I'm seeing more questions. So I've seen it a few times. Does steaming help? I personally haven't heard of steaming as a therapeutic intervention. So I would stick to maybe, masks, vaccines, social distancing. Again, a lot of unknowns. So the answer isn't no, it's not yes, it's we don't know enough to recommend for it. Another question was, if you are fully vaccinated and you see your grandkids who are not, is there a risk for you if you meet with them? So again, I think it was Natasha or someone had mentioned the risk isn't, so you can prevent death with your vaccine, but because you're vaccinated, you can still be a carrier for the virus, and you can still potentially give it to somebody else. So unless every single person you interact with is, aside from that unvaccinated person, you still are at a risk to give someone the virus. So even if you are not at risk of death from COVID, you could still give it to somebody else. So to clear up, if you have the vaccine, it does not mean that you can just go and interact with people unvaccinated and be safe. Be safe, meaning you can still transmit it to somebody else. So that's why we're very emphatic on everyone getting it and holding off on these big reunions just yet. We're so close to the finish line. And then in terms of origins, I think one big thing that I think is a great mindset in life, past, maybe add Dr. Phil to this title. So I think we should focus on what we can control. And what we can control is the actions we take to be proactive and to stay active in preventing harm and preventing what we can do. So get vaccinated. Just regardless of how it comes here, we have to make sure that we can do our part to keep it from spreading further.
There was a question. There've been like 4 questions on nutrition and like whether what you can do like to prevent getting coronavirus. There's a lot of studies, like lots and lots of studies in this like area right now. It's kind of a hot topic. There's a lot of research coming out of the University of Chicago on this, and there's been a lot of studies looking at vitamin D levels and helping provide immunity to COVID. We don't know, they're still trying to figure out like what the daily intake of vitamin D should be to help give you immunity to coronavirus. So in regards to nutrition, there's a lot of studies looking at vitamin D, and it's linked to increasing your immunity towards COVID. One of the studies right now has like 5,000 patients in it out of the University of Chicago.
A lot of people brought up G6PD deficiency and getting the vaccine. I have not heard there's any reason to avoid the vaccine in G6PD deficiency. What we do know is that if you have that, you are higher risk to some degree of having an adverse consequence from the virus. So if you have any medical problem and you're concerned that it may conflict with the vaccine, you should discuss it with your doctors. You know, we have cancer patients who, you know, their doctors have told them to get the vaccine. It's not saying all cancer patients who are on chemo should go get the vaccine. It's just saying it's not an absolute rule out. It doesn't mean there's no absolute contraindication to this vaccine right now, unless you have an anaphylactic, which is a life-threatening allergic reaction to an ingredient in the vaccine. So not a food allergy, but you know, an ingredient in the vaccine. So if you've ever had an IV or an injectable medication and you've had a life-threatening reaction to that medication, then we say, don't get the vaccine right now. Talk to your doctors first. See an allergist and immunologist. They may have a plan for pre-medicating you and really monitoring you closely. But if you have any other medical condition that you're worried about getting the vaccine, you're probably also equally higher worried about getting the virus, because you're more likely to have a really bad consequence of getting the virus. So I really encourage you all to just really talk to your doctors and really make sure that you get the vaccine. Also, I want to just put this out there that this is not direct medical advice. We're just giving information to you and encouragement. You know, we're not, your doctors know you. I don't know anybody who's, you know, I don't know you personally on a medical level. So I wouldn't take this as medical advice, just, you know, public health advice. And one more question I really wanted to address was timing of the vaccine. Someone asked if I can't get it within 3 weeks or 4 weeks, depending on which of the 2-dose vaccines you get, is that a bad thing? The most important thing is don't get the booster shot early. You know, when we give booster shots, which is what this is, or the second vaccine, we study these things to get, you're supposed to get it, what's the minimum timeline that you can get it to get efficacy from that vaccine? So for Moderna and Pfizer, we know that, you know, Pfizer's 3 weeks, Moderna's 4 weeks, and that's your timeline. And if you go past that, that's okay, but don't go sooner than that. But try your best to go as close to that date as possible. And if you can't, you're 1-2 days, even a week later, that's okay. Just don't go earlier, and don't not get that second dose. Whenever you can get it, make it a priority and go get that second dose. Just make sure it's after or on the day that they tell you to go get it.
There was a question on intranasal versus injectable vaccine. The intranasal vaccine is like trying to be developed for COVID, but one of the problems was with the flu vaccine. It was available for the flu vaccine, but it was almost taken off the market because the vaccine that they made intranasally was a live vaccine. These vaccines that we traditionally get are not live vaccines. So if you ever hear someone tell you, I got the flu vaccine and then I got the flu, it's impossible because the virus that's in the vaccine is not alive. The virus that's in the nose is alive. And what they were seeing is people who are getting the intranasal form of the vaccine, they were actually getting the flu because the virus is live. So with the COVID and intranasal administration of the vaccine, they're trying to develop it, but I don't think there'll be high hopes for it because they have to have it. Traditionally, the virus is alive because it has to get into the mucosal membranes in your airway.
So Hormuz just used a bunch of fancy terms. Thanks from us, really smart. I think in summary, so when you get this vaccine, I think someone mentioned it earlier. So what you're getting is sort of like a recipe. You're getting a recipe from this vaccine. It's not the full dish that's being made. Your body's not being exposed to something that is maybe like you would be exposed to in the community. So what he's saying is with this live one, so viruses aren't even living things. They're just, he's saying that the entire structure is not in there. So you're not even, with the injectable one, you're not getting the entire thing. You're just getting maybe like the leg of it or the thing that enters and infects your body. So your body knows maybe the most effective way to prevent getting infected. So long story short, like he said, exactly, you're not getting you're not getting the COVID virus, the entire thing that infects people with this vaccine. You're just getting a small piece of it, so your body knows enough to form a response. Some more questions too were on, I saw one about, oh goodness, all great questions. They got lost in the mix.
There was one question on reservoirs. There have been animals found to be holding reservoirs, mice especially, cats, dogs. But these are all variants. I believe there was something in the news a few months ago about an entire mink farm which had the COVID variant. So yes, there are reservoirs found in animals. That was one of the questions. Another thing I wanted to, I know Bahrom was talking about masks. So this is the surgical mask that we wear in the hospital for the most part. Put it on. I'm gonna take off my headphones. So you put it on like this. You put it nice and tight. Try to get no air out. It's what we wear when we're on the non-COVID floors. And then when you're on the COVID floors, you wear the N95. And this is a really tight-fitted mask. And this is superior to the surgical mask. And you kind of put it on like this, tight fit. This is actually a small, but you want to get it in as much as you can to not get any.
We've got a mask model here, everyone. Look at him. Look at him.
And if you're in the medical field, you actually can even wear a PAPR, which is like a specific sort of mask that sucks in the air and puts it through a filter. So yeah, just the masks that I have here. But yeah, the one thing everyone is saying is, vaccinate, social distance, and make sure you continue to be cognizant of what sort of rules are in your community. The medications that we use for severe COVID infections for people who are admitted, they actually have been changing over the last year, and sometimes we go with whatever data we have. The data is not that strong, but we were in a very difficult situation, and this was a completely new virus that had come out. We went through steroids, we went through something called interleukin-6 inhibitors, which basically help reduce inflammation. We went through antiviral medications, and different parts of the world use different antiviral medications. We use something called remdesivir. In India, they use favipiravir. And these aren't these aren't just giving antibiotics to someone. These are pretty strong medications. So again, we just continue to reinforce the idea that get vaccinated, continue social distancing, and continue wearing masks.
I can comment to a couple of other questions that came up. One, Afri asked if in Canada, they're giving the first dose of the vaccine and then the second dose 4 months later. Is that going to be ineffective? No, it is not going to be ineffective. Like I said, as long as it's at least at that point, at least at that 3 or 4 week mark, depending on which vaccine you're getting, you're going to be fine. You have to get that second dose. What that does mean is that during that time period, until you're 2 weeks after that second dose of the vaccine, you're only going to be like 50% protected. So you're not immune. You are going to be more protected, but you're not fully immune yet. So you still have to get across that finish line. But once you get that second shot, you're going to be okay. And so that's just a different strategy that some countries are using. Know that, we don't have studies. We didn't study this population on like 1 month, 3 month intervals of the second dose, but overall, that's how vaccines work. That's how booster shots work. So in theory, it's going to be just fine. And that's why a lot of countries have chosen that. Another person asked, when can you get the vaccine after getting infected with COVID-19? And this is a very popular question that's come up just in general. So what we worry about when someone gets COVID and they recover from COVID, if you get the vaccine very close to that time period, it may trigger your immune response more aggressively. So you're not going to get COVID again, but you may get the symptoms of COVID again, or you may get worse symptoms. So, you may get worse fever and chills and body aches, and it may last for a few days rather than just a few hours. So your symptoms on an individual basis will likely be worse than if you had gotten it without ever having COVID previously. The CDC initially recommended waiting 90 days to get that vaccine after getting infected. And that was because you're very unlikely to get reinfected with COVID-19 within 90 days. So I usually tell patients, you're really only protected for a season. So if you had COVID, last summer, you're not protected from COVID anymore. Not enough that we would say you're immune. If you had it a month ago, you're pretty protected still. It doesn't mean don't wear a mask and don't social distance. It just means your relative risk is much lower. What I recommend to patients, if you're young and you're healthy, wait at least a month. You're protected for that month. And then after that, just get it as soon as you can in your timeline. If you get it within 60 days of the virus, you are slightly more likely to have worse symptoms, but lots of physicians did that. Lots of residents, lots of medical students, they got COVID, they got the vaccine within a month or two of getting the virus, and their symptoms were worse, but they did fine. And at the end of the day, if you're in a high-risk situation or you're a high-risk patient, it's just important to get it when you can. You might feel worse, but the symptoms are nothing compared to the virus itself. And one last thing I will touch on that came up way long time ago in this chat thread was asking about nutrition and COVID-19 and how can we increase our immunity via nutrition. And I think it's really important to address this because this is something that's actually been highlighted very strongly from COVID-19. That it's very difficult to cover in the media for obvious reasons, but nutrition definitely plays a strong factor in a person's likelihood of succumbing to this virus. We, as I'm sure all of them can attest to, our patients who are unhealthy, who have diabetes and heart disease, and who are obese and have, poor diet and lifestyle, they trend to do on an overall population base worse from this virus. So it is very important to have a healthy diet long term. I mean, we see it with everything, but this is really highlighting it more than ever in our history, how it really discriminates towards patients who are leading unhealthy lives. But no matter how much nutrition you get and how perfect you eat and how much you exercise, it does not mean you shouldn't get the vaccine. It does not mean you're immune to this virus. I had a 40-year-old, super athletic guy, more fit than I've ever seen in a patient who didn't survive. And he was a very well-known case in Austin because no one could believe that he died of COVID. And, he was put on ECMO and we couldn't believe it. No medical problems. He was an athlete and he passed away. And it was just a testament to, we can control what we can control. And the most important thing is to get the vaccine and just not to get infected with the virus.
There's a great question from Burgess Uncle. Hi, Burgess Uncle. Hope you're good. About blood type and your susceptibility to the virus. So that's a great question because a lot of studies are being looked into that. And actually a study just got published in early January of this year that looked at all the different blood types, and they adjusted your probability based on your blood type of getting infected with COVID-19. And what they found is they looked at about 230,000 patients. They looked about half that were less than age 70 and half that are above age 70. and they adjusted the probability. And if you're type O blood, they say you have the lowest risk of contracting COVID virus. Your risk probability is about 2%. And if you have type AB blood, was found to have the highest chance of contracting the virus. So if you're type O, many Zoroastrians are type O, that's a good thing for us. So good question, Burgess.
I think an important point with that is too, is that's just risk. It's just, again, to prevent from getting it out of any blood type, vaccines help. So even if you're type B positive or B minus, whatever, it doesn't, the point is all these things still apply to you. You are not exempt from this. And if you're O positive, you're not exempt from it. You need to get your vaccine, even if your risk is lower. These are just statistics that help us in terms of managing patients if they do come in with these risk factors.
Just quickly, because we're just approaching our time here, I want to ask one final question to our doctors, which is, now that all 4 of you have been vaccinated, how do you feel? Do you feel relaxed? Do you feel happier? Do you feel safer? Just to kind of get an idea of like, what is that initial feeling you get once you're vaccinated?
Okay, I'll go. I got the 2-dose series Pfizer. I was fortunate to not get too significant of side effects. Maybe arm soreness with the first one, and then some chills on like the 24-hour mark of the second dose. And I feel great. I see some questions on, fear or anger. I'm excited. I'm still very hopeful, I guess. Like, we need to be sort of diligent. We're almost at the end of the finish line. If it's a marathon, we're on we don't know what specific mile, but we're towards that tail end where we're just, maybe should we give up? No, we got to power through. So I feel great. I fortunately, knock on wood, don't have any of the scary side effects, or not scary, sorry. I didn't have any of the fever and chills prolonged past maybe a couple hours, and Tylenol helped me.
Yeah, for me, it was similar to Bahrom. I had the Pfizer, both of them about 1 month apart. After the first dose, nothing. I didn't feel anything. After the second dose, I did have, I felt like I was just, I'd spent a lot of time in the gym, and just a lot of fatigue and, delayed sort of muscle soreness. And again, ibuprofen, Tylenol, both those really helped me. After the vaccination, yes, you do feel a lot more confident. You feel there's a lot less fear. But, we still have to push everyone else to get vaccinated, and that's really important.
And just quickly adding to that, thanks for bringing that up, Shahzad. Patients have asked me, are Tylenol and ibuprofen safe? Is it going to affect your recovery or immune response? And it won't. So yeah. I know that's been floating around on some people's routes. It's safe. So yeah. Again, Advil or ibuprofen you take with food because it can upset your stomach. If you're older than 65 or have kidney disease, again, we're not giving medical advice. We're just giving you public health advice. So talk to your doctor when you're getting your vaccine on, is Tylenol and ibuprofen safe for you? But in terms of just affecting COVID, regardless of the medical conditions, it's safe.
I took the vaccine the second week it came out. I didn't really have many qualms about it. And like everybody was saying, I did take an ibuprofen after I got each of the doses. I didn't take it before, I took it after. And apart from a sore arm, that was really the main side effects I got.
Yeah, I took the vaccine pretty early. I mean, probably the first week it was available. I work in the ER, so we were first in line to go get it. And I remember people asking me, like, are you nervous? Like, you're one of the first people to get it out of the trials. And I just I was not nervous at all. Being afraid is normal. That is a normal feeling to have with anything new. But, I cover this strongly on the news. So I've been following these studies from day one, and the science and everything. I read through every part of the Moderna and the Pfizer trials when they were released. There was no fear. I was extremely relieved to read the results. So, I felt really great. It was a very emotional experience. That's for sure. I remember just waiting in line, going in, and just having like a emotional release when you finally feel that weight lifted off your shoulders. You know, every day going into work, every time we would have to, you know, put in a breathing tube in a patient. That's the highest risk procedure to contract COVID from a person, and we do it all the time. And you know, we're setting up all this equipment, plastic coverings to put over the patient, wearing, as Shahzad said, these PAPR devices, which literally look like an astronaut suit that you're sweating in, and it's got a fan blowing at you to protect us. And there was extreme fear every single day. Like, when is it going to happen? When am I going to get the virus? When is it going to happen? You know, I'm just bound to get it. A lot of our younger docs, including myself, were trying to cover for our older physicians, you know, having them, you know, take the heavier shifts off and only work the shorter shifts or in the lower acuity areas of the ER to protect them, you know, because we have to do our job to protect those who are higher risk, even in our own medical group. And so once, man, I wish I could explain to you the feeling of joy of getting through that first and then second dose. When it comes to side effects, yeah, I got it. I was working, so I got it at noon. And then I started my shift at 2 p.m. that day, and I worked until 10 p.m. And, you know, my symptoms kicked in. They don't recommend that, by the way. We recommend, if you can, take 48 hours off after you get the vaccine. Obviously for us, we can't do that. You know, someone's got to be there in the ER. So we can't vaccinate everyone and then tell everyone to take 2 days off. So I was thrown in there right after I got the vaccine, and I was fine. The first time I had 0 symptoms, barely a sore arm. And the second time about 9 p.m., so towards the end of my shift, I just started having some aches and chills and fevers that kind of lasted for a few hours. And then by morning, I was completely normal. And that's normal. You should anticipate feeling that way. Most people do feel that way after the second shot. And with Johnson & Johnson, you're going to feel it after the first shot. But it felt really great. And you will feel that too. And I will say I felt way more relief, even more than that, if that's possible, when my parents got the vaccine. That was the ultimate sense of relief. So really encourage your loved ones and your parents and your grandparents to get it.
Natasha, since you've done things in the media, our good friend Cambyses asked a good question, how with like our small Zoroastrian community, how we can use like social media to kind of encourage people to be vaccinated, wear a mask. Cambyses is friends with all of us. He asked a great question. Since we're all on social media, that's how we stay connected. So if we can just address his question.
Hi, Cambyses. Sorry I missed your question. So that's a great question. You know, in today's society with social media, you know, we're all journalists in our own way. Like, we're all our own little mini media to our loved ones. So there is a sense of responsibility we all have in what we share publicly or share to our families and our friends, because that will impact someone in some way. And so, you know, I really encourage people, get off WhatsApp. I feel like most of the stuff that I get sent to me from family members or whoever on WhatsApp is just, I don't even know like who spends all the time making some of the things that are sent around, and most of them are not based on evidence. You know, they're just ways to get people to feel protected from the virus that we don't have any proof of. So I would say, find the resources that are, you know, that are proven. You know, don't just share articles without reading them. A lot of people will share articles based on the headline, and you have to know that in the media industry, they are incentivized to make, you know, catchy headlines, and the headline will not often tell you what's actually in the full article. It will just get you to click on it. It's clickbait. So make sure you're reading everything that you're sharing. And I think someone asked this, it might've been you, Cambyses, on how to, you know, fight against vaccine hesitancy and encourage people to get the vaccine. And I think the number one thing I can tell people is, you know, never shame anyone. That will never result in an outcome of someone changing their behavior with anything. You know, if you shame someone for their weight or the way they eat or anything, it's just going to make them not want to do it. Same with the vaccine. The most important thing is to just meet people where they are. meet people with compassion and understanding, and try to address what their concerns are. On an individual level, it's much easier to really push for behavior changes than on a public policy, public health level where we're sending public messages, but really try to reach people where it matters to them. Don't you want to be able to see your grandparents and hug your grandparents without worrying about making them fall ill? Really meet them on a level of compassion, and just make sure that, if you're following the CDC guidelines and the CDC recommendations, more than likely, you're doing the right thing and you're doing your due diligence, and that's really all we can do. So I would say just making sure you double check everything you share, and you share everything with love and good thoughts, and good deeds will come from it.
Thank you. Just my final question for all of you, since I know some of you have to leave, just really quickly, if you can just comment on how faith plays in your role. Specifically, the question is how faith plays in a role in your line of work, if you want to say one final piece on that.
I'm very proud. Oh, sorry, Bahrom, you go. You're our moped. You need to go first.
You go ahead.
You're our moped. You need to go first.
Okay, well, I touched on it earlier, and we've all mentioned the different emotions and feelings that that have been invoked during these tough times. But at the end of the day, we're resilient as a race, religion, and I think this is no different exception. For me, it was very emotionally, mentally trying, no social life. So then my physical health, everything was down. Not being able to see people in our beautiful Atishkale in Houston. So there were real effects that affected our health on many levels. And so going forward, even in the moment, that's the beauty of a religion. That's the beauty of it. It's a mindset. It starts up here. You think good thoughts, then you speak good words, you do your good deeds. But it starts from up here. And sometimes it takes us just doing the deed to then start getting the mindset of thinking and speaking. But I think the big point we're making is, this is sort of the trend of, I think, Zoroastrianism. People are stepping up and doing the right thing because it's right. Maybe there's some recognition or whatever, but I think all four of us are here, and all of the attendees are here because they are curious, they want to help. And by acting on that and doing that, I think that's the sign of our religion. For me, just taking that sort of in your N95 where you can barely breathe anyway, but breathing in that, inhaling, exhaling, I personally find that therapeutic while I do my custody prayers or my daily prayers. Very few downtimes during work, but on the way to and from, sort of deep breathing, and my COVID-free lungs now that I'm vaccinated, that's been great. And I think that's the beauty of our religion. We've lasted so long because I think we have found the simplicity and how easy it is to do the right thing. So we should keep doing that. It's simple. Get your vaccine. It's simple. Wear a mask around those who aren't. So, and now you can contribute more. Sorry. I found it, and as a moped, objectively speaking, we have switched things to virtual so we can still be a community. We are right now. We have almost 150 people who are here tuning in from all parts of the world. And so it's within here and here that keeps us going through the things when everything outside is crazy. And it's easier said than done, but I think we're doing that and we should keep doing it.
And to piggyback off that, I think we all love being Zoroastrian. It's very important to us. And with the COVID pandemic, everyone is always asking, how are you dealing with it? What's it like to go home every day and then come back the next day and go through it again? It's been a great opportunity to also educate people on Zoroastrianism, because my whole unit knows I'm Zoroastrian and they always ask great questions about it. So yes, we have our prayers and we have those things that we do every day and turn to, but with everything going on, it's also been a great avenue to educate people on my faith and how it's been helping me get through this situation.
For me, my faith has actually helped guide me in many ways. In medicine, we have a series of medical ethics, such as do no harm, have autonomy of the patient, fidelity to the patient, justice. And I think for me, like a lot of these core principles derive from my Zoroastrian faith. And I mean, there were times, as I mentioned, when I started, on admitting nights, I would pray a Tauverio before going to see patients, because I didn't know what, I was stepping into. And also another thing about my faith is that, one thing that we have heavily sort of emphasized in our religion is this idea of the greater good, or just doing good overall. And you have to kind of take that into account when dealing with patients, whether or not you want to intubate them based on, their oxygen level, whether you want to, see what their wishes are, see what their family's wishes are, have these sort of family discussions. A lot of these things involve ethics, and I believe, my ethical perspective is reinforced by my religion. And of course, I wouldn't be where I am today without my Zoroastrian community growing up with. So I think my faith has been pretty pivotal in what I've done and where I am.
That was beautiful from all of you guys. I agree with everything that all of you said. For me personally, being Zoroastrian definitely affected me in this pandemic. I'm sure all of you can relate to, the feeling of absolute fear at the beginning of this, and the unknown in a way that we've never felt fear before. With any person, I'm sure that brings in religion quite a bit of, like, what if I die? What if my loved ones die? What if I don't survive this pandemic? And, for me, I work in a few hospitals, but two of the hospitals I work at, we don't have an ICU doctor in our ICU after 6 p.m. So, every time I work, I'm responding to everything, even in the ICU and the ER. And during COVID times, that was quite a lot, as you can imagine. And there was a lot of fear. And I remember talking to my dad one day, and when things were first starting, and telling him how afraid I was going into work. And I didn't want to scare my mom, so I didn't call my mom, but I called my dad, and, I was telling him, like, man, I'm afraid, and I think everything will be fine, but are you staying safe? My parents, my dad worked through this entire pandemic because he had to. And so I was extremely afraid for him and myself. And my brother, who's a surgeon in Boston, I was also very afraid for him. And, I remember him just telling me, he's like, we're Zoroastrians. And he's like, we always do the good thing and the right thing. And he's like, you can't sit on the sidelines for this, like, you signed up for this job and you're doing good things for good people and you're helping people. And at the end of the day, you signed up for this. It's like a soldier signing up to go to war. He's like, you signed up. This is your job, your purpose, do it right. You're helping people and you're saving people. And, it really reminded me that that's a lot of our religion is, as we all know, good thoughts, good words, and good deeds, but it's also doing what we genuinely feel is the right thing and the good thing. And I think that really goes into everything during this pandemic, wearing a mask, social distancing, spreading good messages, doing the right thing. And that's always what we've been taught since we were young. And it's a really strong belief in our religion. We're not as fortunate as other religions that get to meet in church every Sunday and, congregate together all the time and have lots of people, lots of Zoroastrians all around us. We really are a small community, but our beliefs and our values are so deep in all of us. And that really helped me. And I'm sure all of us get through the deepest, lowest points in this pandemic and doing the right thing. And we hope to continue doing that for all of you and helping all of you do the right thing also.
I also want to just speak up and thank again Arzan and Tanya. The Instagram page of FEZANA is pretty cool, by the way. A little plug. I am like not the biggest social media guy. I'm involved, but just seeing how present we've been recently, kudos to y'all. Keep it up. I really enjoy that. I like sharing, sending messages, reposting. Y'all do an awesome job. So keep it up. Thank you all, fellow doctors, fellow attendees. Appreciate this very much.
Thank you, Bahrom. Thank you, everyone. Thank you, Tanya. And
Sure,
Arzan as well.
awesome.
Thank you very much. We enjoyed this program that you put together. Thank you, doctors.
Thank you. Again, yes, thank you to our doctors. Thank you, Dr. Natasha, Dr. Shahzad, Dr. Bahrom, and Dr. Hormuz. Thank you so much for your time today, for your expertise, to kind of find, I guess, sum it all up, I know that question was about misinformation being so prevalent today. I think the best thing right now for us to do is to really, give a platform for our doctors to be the voice of advice during this time. And that's what we've done today. And we will continue to do on our social media. We'll make sure that we create an infographic about everything we discussed today that people can share. So for everyone attending, if you're part of associations, please encourage them to also share the video that we will be uploading to our YouTube. We will cut it down to a more social media friendly video with all the tips that people need to kind of see and digest in about a minute. And if you have the platform to encourage more doctors to be given a platform to actually speak and share this advice. And I think the biggest thing that we got out of today is to be more informed, to have to kind of separate the myth from the facts. And I really appreciate that. So thank you. You've ultimately empowered a lot of us today to be able to kind of talk to our relatives, our loved ones, and help them make informed decisions that are going to be, for the greater good, instead of letting fear control us and prevent us from doing the right thing. So thank you again. And thank you everybody else for being here today, for your incredible questions. And we hope to see you at the next FEZANA Talks. Thank you, everybody.
Thank you so much.
Thanks a lot, everybody. It took a long time to kind of get all of this together, and I really appreciate. I know that Natasha and Bahrom are actually in their scrubs and are getting ready to go to work, or are already at work and taking a break from this to come. And probably Shahzad and Hormuz have just this one day off when they're spending this over here. So. Thank you. We really appreciate this, and I know that this conversation won't end here. I think you guys have all given us some amazing tips, and as Tanya said, she will probably put this out in shorter clips and let this message spread. Let everybody who could not be here hear this also in different ways, so that we can all continue to be informed. And one day we can all look back and say that these are lessons we learned, and how we as a community, not only of Zoroastrians but in our local communities, we all came out stronger and better for this. So thank you very much. Our next FEZANA Talks will be a very interesting one. We will be having Kobad Gandhi, who will be in conversation with Porus Cooper. For those of you who don't know Kobad Gandhi, he has been one of India's amazing activists. He stood up for people who are completely downtrodden, spent years in jail on trumped-up charges that the government threw at him, but came out successful. And he was just released from prison recently, and he will be on the FEZANA Talks on April 10th. So mark your calendars. You will hear about it in the days to come, and we hope to do that all of you join us on that talk. So with that, we can the mics are open. If any of the doctors want to stay on, they can do that and answer questions. But if they need to drop off because of work, we completely understand. If you have questions, you want to turn on your cameras, ask them directly, you can do that, or even talk amongst each other. So you can unmute yourselves if you need to.
I unfortunately do have to step out, so it was a pleasure. I do have a shift coming up, so wish y'all all the best. Thanks again for tuning in, and thanks for fellow participants.
Thank you, Bahrom. Thank you.
Thank you.
In here, I have to head to work, but thank you all for joining us. I really appreciate it. And stay safe. We'll all make it through this together.
Thank you, Natasha.
Stay for a little bit if anybody has questions. I think Shahzad.
I know that there was also Kaiwan Dadachanji. Kaiwan, are you still here? Kaiwan answered some questions also on the chat. Kaiwan is also a doctor. So Kaiwan, if you're around, please unmute yourself, and if people have questions, they can ask you all too.
Hey Kaiwan, I got your WhatsApp message.
Uzi's the only expert here.
So Kaiwan's a fellow pediatrician as well. I don't know about how many mRNA vaccines your body can have. I don't know if there's even research on that yet, unless Shahzad knows more.
I know we've bothered you with a lot of questions, but I'm still not clear if my husband and I have taken the vaccine and are fully vaccinated. is it safe for us? I don't know. I'm not talking about whether we can communicate it to the children, but is it safe for us to be in a indoor space with our children and grandchildren who are not vaccinated?
So if you want to, just to be more analytical, if you want to look at the numbers, children comprise 1 to 2% of diagnosed cases of COVID. And of those, pretty much over 60% of them are asymptomatic. And of the children that do get COVID, a very small amount actually end up in the hospital, in the ICUs. So that's very reassuring. But if you are vaccinated, there's always a risk that you can have the COVID virus and you can give it to the children. But a lot of families that are coming to see their newborn babies when they go home, they are interacting with the grandchildren and children. They're just making sure they are vaccinated prior to doing that.
Yes, I understand that we are not at risk and they might be, but are we really not at risk? Can the little asymptomatic child or their parent infect us? Because my husband is at very high risk, but we are both fully vaccinated. What about the 10%?
You could get reinfected with the COVID virus despite being vaccinated. Right now, we don't know what type of immunity the vaccine provides and for how long, whether the immunity is for 6 months, 3 months, we don't know. So there is a chance that you go to a social gathering, even though you're vaccinated, you could test positive for the COVID virus and get the symptoms. We just don't know enough about how our immunity is changed after getting the vaccine and for how long.
It depends on which vaccine you've also gotten. Pfizer. So, I mean, in most studies, Pfizer has been shown to be 95% effective. As you know, there is an element of risk, but the risks of you getting, or you or your husband getting severely ill, are far more minimized with the COVID vaccinations that you have. Is it 100%? No, it's not. But is it going to minimize the risks tremendously? Yes.
So could we meet without masks or not?
I would still recommend you wear masks especially if your husband is extremely ill. But the risks right now would be very minimal, given that you're both vaccinated.
Yeah, the CDC still recommends wearing masks if you're vaccinated and you're interacting with someone who's not vaccinated, regardless.
I was just about to say that, yes. Good job, Kaivan.
Thank you. Thank you. Because the children won't wear masks, but if we are wearing them, maybe at least we are more protected.
Sure. I agree with your sentiments.
Thank you, all of you. You're very patient and you must be superb doctors and clearly great Zoroastrians. Very proud of you. Thank you.
Thank you.
Okay, so if we don't have any other questions, we will call it a day. Thank you, everybody, and wish you a happy rest of the weekend, and see you again on a future FEZANA talk very soon.
All right, thank you.
Thanks, guys. Bye-bye.